Oh, hello. We're back with Moxibustion. This is warming the body, restoring flow, and supporting deep healing. What is Moxibustion? You might be asking. Maybe not. But Moxibustion is a traditional healing practice that uses the warmth of burning mugwort to support the body. But this isn't just about heat, it's about restoring warmth where the body has become cold, depleted, or stagnant. In traditional Chinese medicine, warmth is life-giving. It helps energy move, it supports circulation, it allows the body to receive nourishment more deeply. And after birth, this really matters because birth is not just an event that happens, it's a profound opening. And what has opened needs to lovingly support in the closing process again. So, Moxibustion is a specific practice used in the postpartum. After a woman, not that you can't use it in other times, but I'm talking about in the postpartum. After a woman gives birth, her body is in a very different state than before. From a traditional perspective, birth opens the body deeply, uses a significant amount of energy and blood, and leaves the system more vulnerable to cold and depletion. And this is even without experiencing a significant amount of blood loss. It's just the energy of it all. There is a concept in Chinese medicine called Wei Qi, the body's protective energy. You can think of it as the body's outer shield. After birth, this protective layer is more open, which is why traditional postpartum care emphasizes staying warm, avoiding drafts and cold exposure, resting deeply, and receiving nourishment. This isn't about restriction at all, it's about protection during a time of openness. The Ming Men, the gate of life, this is an area in the body known as the Ming Men, often translated as the gate of life. This area is associated with the kidneys or kidney meridian, the reproductive energy, vitality, and long-term strength, the body's really deep reserves. It's also connected to the process of birth itself, the opening of the pelvis, and the body's ability to bring life through. After birth, this gate does not just snap closed. It requires rest, warmth, and time. Moxibustion is one of the ways we support this natural process, not by forcing anything, but by bringing warmth back to the center of the body, the core, so it can restore itself. Why do we use mugwort? Moxa is made from mugwort, Artemisia vulgaris, a plant that has long been used for moving stagnation, supporting circulation, warming the body, and supporting the womb and blood. When burned, it creates a slow, penetrating warmth that goes deeper than surface heat. This is very different from a heating pad or a hot compress. It's not just warming the skin, it's inviting warmth back into the system. The spirit of mugwort is something I want to talk about too. Mugwort is not only a physical medicine, it's also a protective and intuitive plant ally. Traditionally, mugwort has been used to support dream time and inner vision, strengthen energetic boundaries, help clear what feels heavy or lingering, letting go of the old or freedom from the restrictions of the past, making way for changes. A new day is dawning and or has arrived, especially in the case of birth. Reconnect a person to their inner knowing. And mugwort is also known to support simplicity. So after birth, A woman is not only physically open, she's energetically and emotionally open as well. Obviously, there has been a crossing, a major threshold has been crossed. Mugwort helps support this space by bringing warmth to the body, creating a sense of containment, and supporting the return to self, not by closing her down, but by helping her feel safe, held, and back within her own body. There's also been research exploring the use of moxibustion during pregnancy for babies in a breech position. I thought that was super cool, so I had to share it with you, even though the focus here is postpartum. We're going to talk about this for a moment. A randomized controlled trial published in the Journal of American Medical Association, 1998, found that moxibustion applied to an acupuncture point, bladder 67, was associated with increased fetal movement and a higher rate of babies turning to a head down position compared to standard care. How amazing is that? I love it. So, while results can vary, this study highlights an important principle. Therapeutic warmth can stimulate movement in the body, and in this case, that movement may support natural repositioning. When moxibustion is supportive, it's especially helpful when the body shows signs of cold, depletion, slowness, or stagnation. In postpartum care, this may look like fatigue or low energy, feeling cold easily, sluggish digestion, abdominal discomfort or cramping, lower back weakness, or a sense of not fully coming back into the body. More simply, when the body feels cold, empty, or not quite settled, warmth can help restore movement and presence. I remember hearing a near-death experiencer talk about how it was hard for her to stay really grounded in her body until they started giving her warm baths. So warmth really helps the soul come home into the body on earth. I don't mean home to the other side. So anyway, where to apply moxibustion? We often begin with the foundational areas: low back, sacrum, kidney, Mingmen, deep vitality and restoration, and the lower abdomen, the uterus, digestion, and physical recovery. But healing after birth is not just local, right? It's systemic. You can also support the body more fully through the whole meridian system. The kidney and bladder meridian, this would be the back of the body, the low back, and there are places on the feet. This supports deep energy reserves, recovery from depletion, nervous system stability, and a sense of safety in the body. The spleen stomach meridian is found in the abdomen, and this supports digestion and nourishment, blood building and the immune system, physical strength and recovery. The lungs and large intestine meridian would be the chest and upper back. So this supports our breath and emotional release, processing grief or just really big changes and transition, reestablishing boundaries. This area can feel especially important postpartum when emotions are close to the surface. The heart and small intestine meridian. This supports emotional integration, connecting and bonding, a sense of presence and coherence. The heart is often wide open after birth. Supporting this area can help a woman feel more centered and connected. And then the liver gallbladder meridian. So the liver gallbladder is on the right side of the body, and it supports movement of energy, release of tension or frustration, emotional flow. This is very helpful when the woman or mother is experiencing irritability, feeling stuck, or physically tight. So let's bring it all together. You don't need to treat everything at once, but it's helpful to understand the body heals as a whole. So moxibustion can support physical recovery, nervous system regulation, emotional processing, and energetic integration. How to use a moxa stick is so fun. There's different ways to do it, but I'll just go over one. This is the simplest and safest way to begin. You'll need a moxa stick, a lighter, and a dish or container for the ash. You can even buy a moxa box if you want. So, step by step, number one, you light the end of the moxa stick until it begins to glow. Two, hold it about 1 to 2 inches away from the skin. Move it slowly in small circles over the area. Do not let it be stagnant. Number four, allow the warmth to build gradually. And what you're looking for is a deep, comfortable warmth, slight pinkness of the skin, a sense of relaxation or softening. And then you move to the next area. Do not overheat. A simple flow. You might move through the back and kidney, the abdomen or spleen, the chest for the lungs and heart, and then follow what the body's asking for. You can spend about 15 minutes on the back, and that's perfectly fine. That is enough. A few minutes allowing the warmth to settle inward, then the abdomen or chest. So, this can be done daily for 1 to 2 weeks after birth, or as long as the mother really feels like she needs it. Just a few notes on safety and awareness. Moxibustion should feel nourishing, not intense. It should be relaxing and nourishing. So, of course, don't burn the skin. Keep the moxa moving. Don't let it be stagnant and build too much intense heat. Stop before it becomes too hot. Be mindful of falling ash. Be mindful of the smoke because mugwort can make a lot of smoke. And so we want the air to be moving, a door or a window to be open, but without the mother getting cold or having cold drafts. So good luck. Now, avoid using moxa on areas with reduced sensation, high fever, or strong inflammation. And most importantly, listen to her body. If it doesn't feel supportive, then just pause. And a final note, moxibustion is a beautiful reminder that healing doesn't always come from doing more. Sometimes it comes from restoring what's been lost. Warmth and rest and presence could be plenty, could be all they need. After birth, a woman doesn't need to be pushed back into life either. And hopefully, she doesn't feel that pressure to rush back to life and rush back to independence. Hopefully, she feels like she can go at her own pace and feel supported in doing so. She needs to be held in a space where her body and soul can settle in together with her new baby. And warmth is one of the ways we offer that. Have a beautiful day.